Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cardiomyopathy. What is cardiomyopathy? Cardiomyopathy is the disease of the cardiac muscle. We know that heart has three walls, the pericardium, myocardium, and endocardium. Cardiomyopathy is the disease of the myocardium. So, cardiopathy means the disease of the cardiac muscle not caused by ischemia, valve disease, and inflammation. There are four types of primary cardiomyopathy: hypertrophic cardiomyopathy, dilated cardiomyopathy, this is the most common type, restrictive cardiomyopathy. We also had one more, number 4, arrhythmogenic right ventricular cardiomyopathy. These are the primary cardiomyopathy. We have also secondary cardiomyopathy caused by multiple factors like nutrition, thiamine deficiency, biochemical, potassium and magnesium imbalance, catecholamine, renin excess, storage disease like glycogen storage disease, and endocrine abnormality like that of the thyroid problem. So these are the secondary causes of cardiomyopathy. Okay, so if you look at that, the causes and consequences of dilated and hypertrophic cardiomyopathy. This is the dilated cardiomyopathy. Okay, around 20 to 50% genetic causes. Non-genetic causes include myocarditis, peripartum during and after the delivery of the baby. Some mom may develop dilated cardiomyopathy, toxic due to alcoholism, idiopathic, we don't know the cause. Okay, if you go to the hypertrophic cardiomyopathy, 100% causes are genetic cause. There will be sarcomeric protein disturbances. Hypertrophy is marked. Hypertrophic cardiomyopathy, asymmetric septal hypertrophy, that means asymmetric interventricular septal hypertrophy. There will be fibrosis, interstitial replacement, left ventricular outflow tract plaque, thickened septal vessel. But if you look at both the dilated and hypertrophic cardiomyopathy, endgame is like that: heart failure, sudden death, atrial fibrillation, stroke. Okay, that may happen. Stroke may happen. Atrial fibrillation may lead to blood clot formation. That may lead to stroke. Okay, we got that. Now, hypertrophic cardiomyopathy, massive myocardial hypertrophy. Hypertrophy means increase in the size of the cell without ventricular dilation. The interventricular septum is asymmetrically thickened and may close the anterior leaflet of the mitral valve. Mitral valve is also called left atrioventricular valve, leading to outflow tract obstruction from the left ventricle, may cause sudden death in athletes. Syncope and near syncope can occur. Complaints of dyspnea, there is difficulty in breathing, anginal chest pain, or palpitation may or may not present always. An autosomal dominant disease in 60 to 70% of cases. Others are sporadic, specifically in the elderly population. We'll get fourth heart sound, and we may get systolic apical murmur. Murmur means abnormal heart sound. Treatment by beta blocker, calcium channel blocker, implantation of dual chamber pacemaker, and surgical myomectomy. Okay, we got that. So this is the Picture of hypertrophic cardiomyopathy, asymmetric septal hypertrophy. We got that. Asymmetric septal hypertrophy. Septal muscle bulges into the left ventricle, outflow here. Okay, outflow tract giving rise to a banana-shaped ventricular lumen. This is the ventricular lumen, banana shape. Left atrium is also enlarged here. Left atrium is also enlarged. The anterior mitral leaflet has moved away from the septum and reveals a fibrous endocardial plaque here. Okay, so histologic appearance demonstrating disarray, extreme hypertrophy of the muscle. Muscles are disoriented. Okay, characteristic branching of myocyte as well as interstitial fibrosis. You may get fibrosis. Okay, so cardiac muscle, the nucleus, they are disorganized, disoriented, hypertrophied. Okay, and it is blocking the outflow tract of the left ventricle. There will be asymmetric enlargement of the interventricular septum. Now we'll go to the dilated cardiomyopathy. Most common cardiomyopathy, called congestive cardiomyopathy, may be idiopathic or genetic. Alcoholism is the #1 cause of dilated cardiomyopathy in the United States of America. Shacker's disease, that is a parasitic disease. Doxorubicin toxicity, also donrubicin. These are the anti-cancer drug, antibiotic anti-cancer drug. Hemochromatosis, peripartum cardiomyopathy. Okay, after birth or around the birth of the baby, some mom may develop cardiomyopathy. Finding heart is enlarged and will get the point of maximum impulse very prominent, PMI, S3, S4, third heart sound, fourth heart sound may be audible, murmur, abnormal heart sounds, impaired systolic function, left and right sided heart failure. Evaluation for all cardiomyopathy almost same, chest x-ray, ECG, and bedside echocardiography. Treatment, sodium restriction, ACE inhibitor, diuretics, digoxin, and heart transplant. And advice will be given to the patient not to take part in strenuous physical exercise. Okay, so here's the dilated cardiomyopathy. We're seeing the fibrous tissue here, collagen is in the here, and this is the muscle, cardiac muscle. Okay, 4-chamber dilation, so heart will be enlarged in size. Small mural thrombus. Small mural thrombus can be seen at the apex of the left ventricle. This is the apex of the left ventricle. This is the small mural thrombus. Okay, the non-specific histologic picture, typical of dilated cardiomyopathy, myocyte hypertrophy. This is the myocyte. This is a transverse section. And interstitial fibrosis will get that. Okay, so this is the dilated, this is the ventricle, left ventricle, right atrium, and left atrium. All chambers are dilated. Heart will be enlarged. There will be cardiomegaly. Okay. Restrictive cardiomyopathy, decrease in ventricular compliance resulting in ventricular filling during diastole. So this is a diastolic dysfunction. Heart wall is stiff, secondary to myocardial fibrosis, infiltration, scarring, and thrombosis. Major cause include sarcoidosis, amyloidosis, post-radiation fibrosis, endocardial fibroelastosis, Loeffler syndrome, and hemochromatosis. It may be idiopathic. We may not know the exact cause. Best way to diagnose, how can you diagnose? You can diagnose by taking the myocardial tissue biopsy, that is a confirmatory diagnosis if it is feasible. In physical examination, we'll get jugular venous distension, often Cushman sign, right-sided heart failure, and findings of congestive heart failure. Therapy, symptomatic with diuretic, vasodilator, and an anti-arrhythmic drugs. Again, the workup by ECG, echocardiography, and chest X-ray. These are the routine workup for any type of cardiomyopathy. Okay. Now I'll go to the last one, arrhythmogenic right ventricular cardiomyopathy. Autosomal dominant disorder, right-sided heart failure, arrhythmia may cause sudden cardiac death. Seen in adult population. Right ventricular wall is severely thinned out and myocytes are replaced by fatty infiltrate, fibrosis, and defective proteins in the intercalated disc. Intercalated disc is the intercellular junction between cardiac muscle cells. Okay, here we got this left ventricle, this is the right ventricle. Here is the cardiomyopathy. Right ventricle marked by dilated with focal almost transmural replacement of free wall by adipose tissue and fibrosis. Okay, and fibrosis. Left ventricle has grossly normal appearance. It can be involved in some instances. Right ventricular myocardium is focally replaced by fibrous connective tissue. So here is the connective tissue. This is the right ventricular myocardium is here. Okay, we got that. Now we got the cardiomyopathy. What is cardiomyopathy? Not caused by valvular disease, ischemic disease, or inflammatory disease. This is the disease of the myocardium. So that's all about the cardiomyopathy. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.